Hello everyone, I'm Dr. Shela Hirani, Associate Professor at the University of Regina, Faculty of Nursing. The title of my today's presentation is Sociocultural Factors Affecting Breastfeeding Practices of Mothers in Disaster Relief Camps of Pakistan. Learning Outcomes. By the end of this session, learners will be able to identify the sociocultural factors affecting breastfeeding practices of internally displaced mothers residing in disaster relief camps of Pakistan, share recommendations surrounding provision of culturally sensitive care to promote, protect, and support breastfeeding practices of displaced mothers residing in disaster relief camps. I declare that there is no actual or potential conflict of interest. Background. Globally, each year, death of 760,000 children under the age of 5 is reported, especially during the time of natural disaster. These deaths are mainly due to the consumption of unsafe water and waterborne diseases. Suboptimal breastfeeding practices and subsequent rise in the child and infant mortality is reported during the time of disaster and displacement. Therefore, promotion, protection, and support of the breastfeeding is considered essential to prevent the malnutrition-related mortalities among young children. Although challenges associated with breastfeeding during disaster and displacement are prevalent globally, they are particularly problematic in the context of low and middle-income countries, including Pakistan. Pakistan is one of the South Asian countries that has the second highest infant and child mortality rate in South Asia. In 2010, under 5 child mortality rate in Pakistan was reported as 86 per thousand live births. The geographical location of Pakistan increases the susceptibility of this region to a variety of natural disasters. And during these disasters, approximately 10% rise in the child mortality rate is reported, mainly due to decline in breastfeeding prevalence and subsequent rise in the child mortality due to malnutrition. A review of literature from the global and Pakistani perspective indicate that the lives of women are quite facing the vulnerability during the time of disaster and displacement. They are the ones who also experience the power, control, and social exploitation. During the time of disaster and displacement, the disaster-affected families are allocated the temporary shelters or the tents that actually lack the infrastructure. Specifically, they lack the safe water, sanitation facilities, and the clean utensils. Women also suffer the gender-based violence, and there are the widespread and unscreened distribution of the formula milk during the time of disaster. And this is the point when women actually consider that probably breastfeeding is no more a safe option, and that's why they are being offered the formula milk as a donation. Women also lack the privacy. They also face the compromised nutritional status, and additional to that, there are various myths associated with breastfeeding that also increases the vulnerability of women and young children during disaster and displacement. No doubt review of literature highlighted few of the points that where exactly there are the possibilities of barriers and hindrance towards the breastfeeding practices at the time of natural disasters. However, none of these points actually indicate that what are the socio-cultural factors that are actually facilitating the breastfeeding practices or hindering the breastfeeding practices during the time of disaster. In view of research gap, the aim of my study was to examine the socio-cultural factors that were directly or indirectly affecting the breastfeeding practices of mothers who were residing in disaster relief camps in Pakistan. I used the critical ethnographic study design in order to unveil the wide range of experiences surrounding the socio-cultural factors that were affecting the breastfeeding practices of these mothers. I undertook the study in Chitral, Pakistan, which is the mountainous and northernmost region in Pakistan. As you can see in this map marked in red is Chitral, which was not only facing the recurrent disaster, but since it was sharing the boundary with Afghanistan, this area was also politically unstable. I collected the data in the 4 different villages in Chitral, including Shali, Zitur, Bishkir, and Bumrit. I used the multiple methods of data collection, including the in-depth interviews, observation, and document analysis. The in-depth interviews were conducted in different villages with 18 internally displaced mothers having the children aged 1 day to 36 months of age. We also recruited the mothers who were having the varied breastfeeding practices, including those mothers who were not breastfeeding at the time of interview. The research received the funding by International Development Research Center and Sigma Theta Tau International, and Aga Khan Agency of Habitat was the humanitarian agency that served as a collaborator and the knowledge user. My fieldwork in the setting of disaster relief camp, and especially in the time of disaster when I was traveling to Chitral, was quite challenging because each day there were the travel of around 6 hours on the unstable mountainous regions that were quite facing the vulnerable situation due to the landsliding, and there were no proper roads available. And then each day when I was traveling to the villages, I saw that none of the houses were there on the on the land, but there were debris from the mountain that were accumulated in the residential land after the glacial lake outburst flooding and the earthquake. So where these mothers were living, they were actually living at the top of the hill, and they were having the temporary housing, including the green shelters as well as the tents where they were residing. And there were no such facilities for mothers were available in terms of the sanitation, bedding facilities, as well as other necessities of life. Now the findings. First of all, I would present all the facilitators, especially from the sociocultural perspective, what were supportive of breastfeeding. So the foremost facilitator were highlighted by mothers as the informal support from their immediate extended family members, relatives, neighbors, and the neighboring villagers. Mothers specified that they are the source of greatest support to them because they provide the nutritional guidance, they provide all the assistance. They are the one who actually guide the mothers in terms of what they should eat, in terms of increasing the breast milk supply. They are the one who actually offered variety of other supports, including the assistance in meeting the childcare responsibilities and household chores, even during the time of disaster and displacement. Mothers further acknowledged the support from the healthcare professional, and they acknowledged the role of formal support in facilitating their breastfeeding practices. In this regard, the role of nutritional guidance, informational support through the booklets, and other aspects of the curative and health promotive measures were highly acknowledged by mothers. Mothers highlighted that there are various cultural aspects that are supportive of their breastfeeding practices. And some of those cultural aspects included the cultural norms of feeding the child the first feed, which is colostrum, and continuing the breastfeeding up to the age of 5 years of the child's age. Mothers further acknowledge that there is no gender disparity at the household or the family level, and that's also support their nutritional status, and they are further able to breastfeed their child. Mothers further acknowledge that there are various spiritual practices in their socio-cultural environment that are quite supportive of their breastfeeding practices. Mothers acknowledge the role of prayers, religious ritual, as well as spiritual treatment and healing in increasing their resilience and increasing their confidence that supports a lot of their breastfeeding practices. Now I would present some of the barriers, the sociocultural barriers that were hindering the breastfeeding practices of mothers. Almost all women, all mother talked about the lack of privacy and women-friendly spaces to breastfeed during the time of disaster and displacement. And I would like to here share one of the quotes here in which a mother said, "When you are homeless, as a mother, it becomes very difficult. It becomes embarrassing when you have to breastfeed your child and you are on the streets and in the open space. It doesn't feel good, nor it is something that a mother feels comfortable to breastfeed." So this quote itself highlights that how important it is to have the privacy to breastfeed and having a space that are supportive of their breastfeeding practices. Mothers specified that few cultural beliefs and practices surrounding the food, the supernatural forces beliefs, and encouragement of the cow's milk and tea in the village, especially feeding those type of the pre-lactal feeds to the children when they are even too young for having them, actually serve as a barrier to their breastfeeding practices. Women acknowledge that there are the covert oppression during the time of disaster and displacement, since they are living in a system where there is more of the dominance of the males as compared to the female. So again, this is there are some societal expectation for women to remain in the house, practice the complete veil, or not to breastfeed in public. And whenever they are doing so, whenever they are moving out of their house without seeking the permission of males, or breastfeeding in public because they are now homeless, so they actually face so much oppression from the society. And many a times women mention that actually that makes them feel that they are lacking the empowerment, and they also face the negativity on them, especially when they are in the state of when they are dependent on others for their survival. Mothers further highlighted that there are lack of healthcare support since the healthcare settings are quite far placed or already damaged after the disaster. They have the inaccessibility to those support. Those healthcare facilities that are available, they are quite inaccessible or quite unaffordable. And again, there are infrequent visits by the healthcare workers that also make them quite vulnerable. And many times they drop the idea of sustaining their breastfeeding practices. Female mothers who were like in the state of disaster and the displacement in that setting, they also highlighted that the family circumstances, especially the geographical separation from the family during the disaster, also disrupt their support system and affect their breastfeeding practices by altering their decision making processes. So few recommendations from this study. At the practice setting, there is a need of empowering the local people who could be the source of formal support for these mothers, establishment of the well-being camps to offer the preventive, curative, and rehabilitative services is very essential. Also, since the privacy is valued by breastfeeding mother during that time, the creation of women and breastfeeding friendly spaces are quite essential. And also, since religion and prayers are important rituals, there should be this proper spaces for such rituals that can actually promote the well-being of those mothers. Also, there is a need of promoting the breastfeeding culture in the village, and especially with those mothers who are affected by disaster through various avenues. Also, for the policy, local, provincial, and federal policy to support the privacy needs of the mother affected by disaster and displacement must be in place. In the education setting, there should be the courses on disaster management and program planning to better prepare the future healthcare professionals and interdisciplinary professionals to provide this culturally sensitive, gender sensitive, and context specific care during the time of disaster and displacement. This study actually contributed to the development of the nursing knowledge by giving us the highlights on the variety of socio-cultural factors affecting breastfeeding practices. It also highlighted the role of program policies and practices during the time of disaster. It also helped us to understand that how important it is to work for Sustainable Goal Development 3, so that we can also promote the well-being of these mothers. It would also assist in the future research. Here are a few publications of mine that I really recommend the audience to look at. Here are a few references from today's presentation. Here are my contact details. If you have any question, you are most welcome to email me your questions. Thank you so much for your attendance.